and the vaccination program. I'd first like to begin this evening by acknowledging that we are gathered here today on the traditional and unceded territory of the Halkhameen-speaking people, Coast Salish people. I think COVID-19 has affected all of our communities and all of us, but there's been a very acute impact to our Indigenous communities. So thank you so much for joining us here this evening. I think we have a really wonderful opportunity to engage with our partners at Fraser Health and have a really good community discussion about COVID-19 and the vaccination program that's currently underway. Now, this evening, we're going to have an opportunity to share some information from Fraser Health and from the city, but I think a big part of tonight is giving an opportunity for people to ask questions of us. We've got some excellent panelists from Fraser Health, so I do want to encourage people to use the Q&A function that they see on the screen and just type in your questions, and we're going to do our best to try and get to as many questions as possible. So please engage and please participate. We want to be here to be able to answer your questions. Now, I'd like to introduce our panelists this evening. Joining us from Fraser Health, first we have Dr. Ingrid Tyler, who is the Medical Health Officer and Executive Medical Director of Population and Public Health at Fraser Health. Thank you so much for joining us this evening, Dr. Tyler. We also have Sharat Chandra. Mr. Chandra is part of Fraser Health's vaccine logistics teams and is the Chief Project Officer for the redevelopment of Royal Columbian Hospital. So really appreciate that you're able to join us this evening to have this community conversation. I'm also joined this evening with my colleague on City Council, Councillor Chinu Das, who is the chair of the city's Senior Advisory Committee and Multicultural Community. So thank you, Chinu, for joining us. Now, Chinu and I are actually here tonight at the Anvil Center, which is an important community venue, but it's become even more important now because it's actually become the central vaccine location here in the city of New Westminster, and I know our friends at Fraser Health are going to talk a little bit more about that tonight. So with that, I would like to take an opportunity to introduce our guests to make a bit of a presentation to our community. So if I can invite Dr. Ingrid Tyler and Sharat Chandra to say a few words.
Hi, thank you very much. Good evening, everyone. Sharat and I are very grateful to be here with you tonight to talk about the important work that Fraser Health is doing to get our communities immunized, including New Westminster, and to answer some of your questions about that process. After a tremendous amount of planning, training, implementation, and public participation, we are seeing our rate of immunization increase every day. Almost 1 in 5 British Columbians have now received their first dose of COVID-19 vaccine, and it's great to have this additional layer of protection as we continue to respond to the COVID-19 pandemic. Registration for immunization is now open for those over 65 years and for Indigenous people 18 and older, as well as those who are clinically extremely vulnerable who have received an invitation letter. We're strongly urging everyone who is eligible to receive their vaccine to register now so that they can then book an appointment as soon as it is available. Earlier this week, Fraser Health's booking tool transitioned to the provincial system, which is called Get Vaccinated. So you can register your interest in vaccination now online at getvaccinated.gov.bc.ca. There's also a phone number, or you can go in person to a BC Services Centre. People aged 55 to 65 can also get the AstraZeneca Covishield vaccine at eligible pharmacies that have current supply. You can visit the British Columbia Pharmacy Association website to find a participating site near you. But please don't get discouraged if it takes a little longer to book your appointment. Anyone who's eligible for the vaccine and wants to be immunized will get their immunization. The province's immunization plan does depend on a consistent delivery of Health Canada approved vaccine supply from the federal government. Over the coming months, therefore, the vaccination timelines for different groups of people may change based on how much vaccine is currently available. We've been getting questions about which vaccines are used and how they're being used. It's important for you to know that the public COVID-19 immunization clinics offer either the Pfizer or Moderna vaccine. And as I just mentioned, the AstraZeneca Covishield vaccine is available at eligible pharmacies for people aged 55 to 65. All around the world, millions of people have already been immunized. And every day, we're learning more about the vaccine through information collected during clinical trials. So our overall body of knowledge about these vaccines continues to increase. To date, the research has confirmed that these vaccines are safe, they're highly effective, and they are much safer than being infected with COVID-19 itself. The approved vaccines provide immunity against COVID-19. They're very effective at preventing hospitalization and death, regardless of a person's age. At the same time, though, it is still crucial that everyone who receives the vaccine continues to follow public health guidance and orders from the provincial health officer. As you heard at the provincial briefing this afternoon, we are seeing high numbers of cases in Fraser Health. 645 today out of about 1,293 total cases in the province. So about 50% of cases are in our region, and these are now increasingly the variants of concern. So after you get a vaccine, we're not out of the woods yet. You need to keep up those preventative measures, such as washing your hands, maintaining a safe physical distance, wearing a mask, and staying at home when sick. It is critically important for people to stay at home when sick and to get tested as soon as they experience COVID-19-like symptoms, even if they are mild ones. Testing for the virus will help prevent spread of COVID-19 and leads to rapid identification of cases and immediate isolation to help prevent further transmission and prevent outbreaks in our workplaces and other community settings. With high rates of COVID-19 transmission in our communities right now, in spite of our ongoing vaccination efforts, with some increasing prevalence of variants, testing and public health measures continue to be crucial. I do want to acknowledge the toll that the pandemic is taking on all of us, in particular on our mental health across the board. And I want to take this opportunity to encourage anyone who's concerned about their mental health or a loved one's mental health to visit the Fraser Health Mental Health and Substance Use website for information about resources that are available to you and your family. I'm now going to hand over the mic to my colleague, Sharat Chandra, Chief Project Officer and Executive Director, who will talk a bit about the logistics of our rollout, and I look forward to taking your questions soon.
Thank you, Dr. Tyler, and good evening, everyone. So over the past year, we have to learn to pivot quickly to respond to new information we have received about COVID-19, as well as what we are seeing in our communities. A great example of this partnership in real time was our ability to quickly identify and open locations for testing clinics, and now the immunization clinics in our region. Now, for New Westminster, the city has been a great partner, and we are grateful for their continued support as we draw closer to immunizing our communities and getting onto phase 3 and phase 4. We're also grateful for all the efforts of our healthcare partners in the community as we see other sectors stepping in to support our immunization. Now, we have been working to establish clinics that are close to where people work and live in convenient locations. When we look at New Westminster as an area, this includes locations at Douglas College just around the corner and at Century House Uptown. And as of yesterday, we opened Anvil Center. Now, in addition to being easily accessible by our members of our communities, these locations also meet our needs in terms of the scope and the logistics required to deliver vaccine to these locations in thousands, so that it can reach to thousands of people in our community. Now, as we move forward into the next phase of BC's COVID-19 immunization plan, we are monitoring these volumes on a daily basis, and we are seeing at our sites across our region, and we'll be able to flex the clinics up and down to meet our community's needs and as and when we get the supplies accordingly. An immunization plan of this magnitude requires a tremendous amount of work behind the scenes, and I would like to acknowledge at this time the ongoing contributions of the Fraser Health team that has worked tirelessly to open our immunization clinic to ensure we are able to deliver the vaccine to all members of our communities across the overall Fraser Health region. Since our planning process began, this team has worked to identify appropriate locations, plan and coordinate the logistical demands of opening each clinic, as well as hire and schedule the staff to maintain and operate these clinics. Now, the scope of this project has been unprecedented, and I am so appreciative of the dedication of our team and our partners to continue to demonstrate both on the ground and behind the scenes. So thank you so much.
Well, thank you, Mr. Sandra and Dr. Tyler. We really appreciate you joining us. So I do want to encourage folks to put in your questions at the Q&A feature at the bottom. Type them in. We will be opening up to questions very soon, and this is a really good opportunity to be able to talk directly with our experts. Now, right here in New Westminster, we know this has been a challenging year. We know many people have been impacted by a variety of ways by COVID-19, and no doubt the city of New Westminster has really had to change a lot of how we do our work. I think from City Council's perspective, we've really tried to focus our efforts on how do we meet the needs of those most vulnerable and those most impacted with COVID-19, and a lot of our focus has been geared towards that. But we've also had to change the way we operate, how we do our work at the city. A lot of the services that we offer, whether it's Parks and Recreation or just general services involving City Hall, haven't been able to operate the same way. But it took us a little while after the outbreak broke out last spring, but we really have worked hard to change the way we operate and open up our facilities. We've also seen a tremendous use of our city parks during COVID-19, and this is something obviously we welcome and encourage. I think people have needed that opportunity to have that access and connection to our public spaces, and we've done our best as the city to try and open up so that people can enjoy those spaces safely in the community. We certainly know it's been a tough time, and we certainly have wanted to be open and connected with our community, but we haven't been able to connect the way we normally do. So hopefully forums like this are good opportunities for us to kind of continue to engage and connect. Now, I'd like to give an opportunity for my colleague, Councillor Doss, to expand a little bit more and talk about some of the work and programs we've done at the City of New Westminster.
Thank you, Mayor Cote. I wanted to talk a little bit about the task forces that we've set up, or working groups. We have several task forces, but I want to speak to three of them in particular today. The first one being a task force for vulnerable and at-risk people. And what that addresses is the vulnerabilities that the people have faced as a result of COVID-19. And what the task force has taken on, and I have to say this has been in collaboration with all the not-for-profit organizations in the city, as well as faith organizations, lots of volunteers and funders. And as a result of the collaboration of all four elements, we've been able to look after shelter needs, food supports, just health and hygiene, such as laundry, bathrooms, etc. And they've been very invaluable to this community. We have also set up a digital inclusion program for the vulnerable population, and they have, as a result of that, got refurbished smartphones for use, and also been informed about where the Wi-Fi sites may be so they can keep up to date about COVID information. That is the task force for vulnerable and at-risk people. The second task force I want to talk about is for seniors and people with disabilities. And all of the other things that I've mentioned so far are also applicable to seniors and people with disabilities. But in addition to that, there's been a strong focus on social inclusion. A lot of the seniors are feeling very, very socially isolated, and a lot of effort has gone on reaching those who are feeling socially isolated. So we have the Friendly Caller program, and this is volunteer seniors reaching out to other seniors just to have a chat and check in and see how they're doing and if they need any information or supports. So that has been very successful. There are also other things like coffee mornings for them, all digital. And the last group I want to talk about, or the task force, is on childcare. Now, childcare is a great need in the city, and we're doing everything to address that pre-pandemic, during the pandemic, and post-pandemic. And we are trying to adjust during the pandemic period as much as possible to what the public health guides us towards. So it has been a little bit of fluctuating. There's been a lot of flexibility and adaptability, but I think we're right now at a balanced state because a lot of the parents are working from home. So there isn't a great imbalance in this process at all. So I think those are the three that I wanted to highlight today. I know there are lots of other things we're doing as well.
No, well, thank you, Chinu, and really appreciate all the work that you've been able to do and champion during this really difficult time in the community. And I know council has continued to do our work, but we've had to do our work a little bit differently. I think this is the first time you and I have been in the same building for probably yes. months, but we've continued to do our council meetings, but we've been doing them electronically and trying to continue to be as open and transparent with the public. But like many things this past year, we've had to work differently. So really appreciate that update. So we're now going to transition to an opportunity for folks to be able to ask their questions and connect with our partners at Fraser Health, but also if there's any questions for myself or Councillor Doss as well too. So if people could use the Q&A feature on the Zoom screen and type in your questions, we're now going to open that up. So I do have a first question here from James, and he asks that at 86 plus years of age, I've already had the first Moderna shot and was told that it will be months before I can get the second shot. My question is, will I be notified when it's time to come to book an appointment, or will it be my responsibility to book an appointment? And if so, when should I contact Fraser Health?
I can take that. So people who are getting their first vaccine doses, they will be notified by email, text, or phone call when they're eligible to book an appointment for their second dose.
Okay. Well, thank you. So we'll now move to the next question.
Okay. So this is from Tim. Many seniors in New Westminster need transportation to get to their COVID-19 vaccination appointments. Why isn't Fraser Health working with TransLink and HandyDart to offer free rides to seniors so that they can make these appointments? Would you like to take that, Mayor Cody?
Yeah, I can probably take that question because this has definitely been a topic of conversation at the Mayor's Council and with TransLink, and certainly our public transit system has faced its impacts because of COVID-19, but TransLink certainly has wanted to step up to be a partner to help, and I think there's a number of examples where TransLink has done that, including even making some of their parking lot sites and unused sites available for vaccinations and testing locations. But with respect to the question, TransLink is in close connection with Fraser Health to try and set up partnerships to see how the HandyDart system and the public transit system can help make sure that the vaccination program is successful. And I do know that pilot projects have been set up so far that have worked to utilize the HandyDart system, and I know TransLink is working hard to get the window in terms of booking the HandyDart appointments, which sometimes are a longer window in time to actually coordinate with the short time window to get to the vaccination. So it is an ongoing effort, and it is requiring some changes, but TransLink and HandyDart are certainly doing their best to make sure that service is open and accessible and going to be available for seniors that need help being able to get to vaccination locations. So I don't know if Mr. Chandra or Dr. Tyler have anything further to add in terms of people getting to the vaccination sites and any opportunities or challenges that folks might face.
Mayor Cody, thanks for this, and I think you summarized it really well. I would just add, like, overall in the region, Fraser Health is working both with TransLink and BC Transit. And as part of this, we are in the works of developing an overall transportation strategy. And as Mayor Kote already mentioned, we have been running some pilot programs in various communities to trial some transportation options. So we do look forward in the next few weeks, we would be able to unravel and roll some more options for our communities in the Fraser Health region. Thank you.
Okay, well, thanks very much. So we're going to go to our next question, which comes from Michael. The BC government website advises people who are not allergic to components of a certain vaccination to not get the vaccine. Where do I find out, A, what vaccine is being administered where, and B, a list of the components in each vaccine so that as a patient, I can make an informed decision on its potential to cause an allergic reaction to me?
No problem, I can take that one. So we already briefly discussed about which vaccine is where. So most of our vaccine clinics, well, all of our vaccine clinics are giving either Pfizer or Moderna. And if you are taking advantage of the 55 to 65-year-old opportunity at the various pharmacies, then you will be getting the AstraZeneca vaccine. Health Canada is responsible for approving all pharmaceutical products within the country and has that safety information. So that's the first website I would send you to look up the safety information, but I suspect it's also posted on the BC CDC and BC government websites to understand the components of the vaccine. The manufacturers themselves also publish the components of the vaccine in on their websites. Now, the majority of the components of the vaccine are innocuous. There's one component in the mRNA vaccine called PEG, which has been linked to some allergic reactions. So currently, the only contraindication or consideration to be thinking of for taking these vaccines is whether you have a history of PEG allergy. PEG can be found in some other medical products like some IV fluids and some others. So if you have a history of PEG allergy, you're probably aware of it. And that's the only allergen that we are aware of or concerned about in the current available vaccines.
Okay, thank you.
Next question. Yeah, this is from Candy. I'm 61. Will I be able to get vaccinated at Anvil when it's my time? I don't have a car and I need somewhere that is accessible by bus. So I guess this is a little bit of transit.
Yeah, well, you know, the Anvil Center, I think, has become the main vaccination center at the city of New Westminster, and you know, I think one of the reasons this location was chosen by Fraser Health is its good accessibility to public transit. It is right across the street from the New West SkyTrain station, which also has a bus loop where all of the major buses in the city of New Westminster Lake. So I think from a public transit access point of view, the Anvil Center should be a really good location for people to be able to get their vaccines. I don't know if our partners from Fraser Health want to comment a little bit about you know, some of the thinking behind some of the locations and how people can access them as to why certain sites were chosen.
Yeah, no, for sure. Like overall, I think in the region, the Fraser Health region, when we looked at the sites, both from an overall transit access as well as in some of our other communities, we looked at highway access as well. Like within communities like New Westminster, Burnaby, we did pay attention to making sure that how do we reach out to the maximum population, and SkyTrains and TransLinks and the corresponding transit was one of the key factor. Anvil Center definitely fits into one of those criteria with such a great accessibility, both from the highway as well as from the public transit there. And in terms of the specific question, when the eligibility is open for 60 to 64, definitely there would be appointments in Anvil Center, and we do look forward to having you vaccinated there.
Okay, thank you. So we'll go to the next question now, and just a reminder to folks to put your questions in the Q&A feature, type them out, and we're going to do our best to get to all of the questions.
Yeah. Next question.
Okay, I think this question has already been covered. if we can maybe move to the next question. Sorry. We're all learning the wonderful technical advances of Zoom, so we're all learning. Okay, so the next question we have, what will be, how will the new public health orders impact youth sports? The kids are getting tired of just practicing. They want to play some actual games. So I'm wondering if our partners from Fraser Health have some background on that.
Yeah, thank you for that question. We are in a position right now where our cases are increasing. And in fact, we have the vast majority of cases in BC are in our region and in Fraser Health. So now is not the time, I can certainly speak to that, now is not the time that we're going to be encouraging people who don't otherwise have contact with each other, like households or very close family members, to be congregating in any way, shape, or form. There is some risk associated with sports, depending on the activity specifically, close contact, heavier breathing, more ability to produce aerosols that might travel further as a result. So it's not an innocuous activity. We very much, as a public health community and as a health community, understand the significant sacrifices that people have made and the impacts that our public health orders and our efforts to contain this disease have had on people. That is not lost on us, and I know it's been a really difficult year. The vaccine gives us some hope. We need many more people to be vaccinated for us to, and cases to go down, for us to be in a position to start loosening any restrictions that are currently in place.
No, well, thank you, Dr. Tyler, for that. As a parent of three young kids, I can certainly connect with the residents' question there. I know it's been a challenging year for families and households with kids, and there's been times where the kids have been bouncing off the walls at my home. But I think as Dr. Tyler said, we need to stay focused and continue to follow the rules, because that's what's going to help us get through this sooner, and that's what's going to help the vaccination program be as effective as quickly as possible.
Thank you. So there's a question from Joy. Will you be opening up Century House as a vaccination clinic again, or anywhere else uptown? Well, I think
we'll probably have to go back to our friends at Fraser Health. I know Century House has been used so far for some targeted vaccination campaigns, but with respect to into the future, any future plans to use that facility or anywhere else in Uptown, which is a part of the city that has a heavier demographic of seniors in our community?
For sure. At this point, with the Anvil House being brought online, our intent is to make sure that we can monitor the immunization in the Anvil Center. That's definitely one of our bigger sites where we have the capacity to kind of ramp up as the demand increases and as we get more supplies. For future, definitely these are some of the daily monitoring that we are doing, and based on that, if there is a need to look at and reach to certain communities or certain part of the communities, we would be considering some of those options in future.
Okay, no, we'll appreciate that answer. And Dr. Tyler, I don't know if you had more to add or no. So I think from the city's perspective, we're not in charge of the vaccination program, but we wanted to be that willing partner to make our facilities available and accessible. And I know Fraser Health has restrictions in place to make the vaccination program as effective as possible. And I think the Anvil Center was chosen for a few reasons, and one, because it's such a large facility and the types of numbers that we need to see, and many of our other civic facilities unfortunately didn't have that type of capacity. So we're going to go to our next question from Marlies. Do Pfizer and Moderna give lifetime immunity, or will we have to continue vaccinations yearly? And do Pfizer and Moderna require a second shot?
Yeah, thanks for the question. It's a really good one. So we do know that Pfizer and Moderna and AstraZeneca give very good protection after 2 or 3 weeks, after you get the immunization, you have very good protection from all the vaccines that are currently available. And that is just based on 1 dose information. We know that a second dose will increase that protection further, but your initial protection is very, very good. They do require a second dose. So all of the vaccines do require 2 doses. As I saw in another question here, there is now a delay between the 2 doses. Up to 4 months is what the province is recommending. And that is because of the evidence that we know that 1 shot gives very, very good protection. But we do not know the extent of the length of that protection specifically. These vaccines have only been around for less than a year. We've only had COVID for about a year. So we don't have the information right now to answer the first part of your question. Does it give lifelong immunity, or will we have to continue vaccinations yearly? That information will become more available to us as we have more time to learn how to live with COVID. For now, our priority is to give everybody their first shot and then everybody their second shot, so we can maximize our population level immunity, not just protect the individual from getting COVID themselves, but protect the whole population through something called herd immunity, so that the virus is less likely to transfer between people. That's our immediate priority. After we get there, we'll have a lot more information and we'll be able to start to give better answers to some of those longer term questions, which are really good ones, like how often do we need to get re-immunized, if in fact we need to get re-immunized, and how long does immunity last exactly. Now, I have one more thing to add. People are concerned about the extension of the period between doses to 4 months. I just do want to remind people that based on all the other immunizations that we have, there is absolutely no reason to believe that one becomes sort of unimmune. For example, a tetanus shot, we ask people to boost that every 10 years. We check pregnant women, you get immunized for measles as a baby, and then we check pregnant women for their titers. And most pregnant women are still immune, and a few need a booster at that time. So from all the vaccine information we have every reason to believe that immunity is long lasting. We don't know exactly how long, for example, tetanus boosters every 10 years, but we have never seen an immunity to kind of drop off a cliff after just a few months following vaccination. So we can be reassured that the protection from a single first dose is very, very good, and that that immunity can get locked in and boosted with a second dose, and that we will have significant benefits for the entire population to get as many people as immune as possible quickly, and then deliver second doses for that that added boost. And then we will be continuing to study and learning to live with COVID for a number of years to come, I'm sure.
Okay, well, thank you, Dr. Tyler, for that answer. I think it's definitely encouraging and comforting to hear. So I do want to encourage folks that have joined us this evening. If you do have a question, please go to the Q&A feature to feed in your questions, and we're going to do our best to try and get to all of the questions that have been provided. So,
okay, the next question from Kelly: how many vaccinations can be done each day in New Westminster?
I can take that. So overall, when we were looking at all our capacity across the region, it's based on the demography and the population in each of the community. Our clinics in together across the Fraser Health region has the capacity to anywhere from 9,000 per day to 22,000 per day. So depending on the uptake and depending on the vaccine supplies and how the corresponding age cohorts would be opened, the capacity in each of our clinics could be flexed, as I mentioned earlier. With our New West clinics, we are starting off with 10 stations there based on the corresponding population. And as and when more population would be opened, we would be able to monitor that and cater to the demands that we have.
Okay, well, thank you. And I definitely, being at the Anvil Center this evening, it was it was wonderful to see how busy and what a hub of activity as the vaccination process is definitely well underway here. So it, and hopefully it will just continue to wrap up and be effective. So we do have another question from Dr. Sen. All new Westminster vaccination clinic locations are booked. Where should I go to get vaccinated?
Okay, I can probably take that. So right now, I would assume that if you're going to the new site, as Dr. Tyler mentioned earlier this week, April 6th, the provincial system, like we transition over to the provincial system. So if you go to www.gov.bc.ca, get vaccinated, we would be able to see appointments in next week. There are more options, like if we want to get it this week, there are more options available across the other Fraser Health regions. But if you look at for next week, it should be coming out. And as more appointments would be made available for the week of April 19th, you would see further options being made available across different areas, including New Westminster.
Well, thank you. Well, Councillor Doss, I know you've recently signed up for your vaccination next week. Maybe you can share with folks your experience.
Yes, absolutely. Actually, it was so simple and easy, the new provincial the system. It was yesterday. I registered at about 11 o'clock. By 1 o'clock, I had heard back from them because I'm in the age cohort that is eligible. So they asked me to book an appointment. It took less than 5 minutes, and I have my appointment for next Tuesday. It was very, very seamless. I was quite surprised because I had heard stories about how long you have to wait on the phone or online. It was absolutely a breeze.
No, well, and I know my age cohort hasn't come up quite yet, but even me and my wife have already registered online there, and we've got it signed up that we're going to get a text message as soon as we're eligible to sign up. So we do want to encourage everyone to get registered, get online, so that you can know right away when you're available to get signed up. So we are going to go, if we have any more questions. I'll go to the screen. Okay, so we do have a question coming up. How or when do I receive proof that I've had the vaccine after the second dose?
So I can take that one. I understand that vaccine cards are available at the clinic. So you are given a vaccine card following your vaccination. It is even after your first dose, it's helpful to keep that card in case you can't remember what product you received for whatever reason, because when it's time to receive your second dose, you're going to want to get that same product. And then if you continue to keep that card, it will also mention on there that you have your second dose, and that will be your proof of vaccine.
Okay, thank you.
Okay, here's a question from Elizabeth. Can you please advise if I can possibly book an appointment for my mom online? We are residents of New Westminster. I advised her to call, but she can be hard of hearing and has some language barrier.
I can definitely take that one. So yes, as Dr. Tyler initially mentioned, with the transitioning onto the new provincial system, there are 3 different options that we can look into. So one, in this particular case, definitely we can go online to the Get Vaccinated website. So that's www.gov.bc/get vaccinated. And as Mayor Cote and Councillor Das has been sharing their experience, one can register there and they would be getting information either through email or SMS for available appointments when they are eligible. In this particular case, if they're eligible, they should be getting that confirmation through email or the preferred phone number. The other option that we have is definitely the call center, and the call center does offer interpreter services if that's an option that the citizens wants to consider. And the third option is, if in person, definitely we can go to one of the service BC sites around the community there.
Thank you. So we still have some time available this evening to answer some questions. So I do want to remind folks to type in their question if they do have a question. We now have a question from Facebook. What can be done for seniors who need to get out daily and keep mobile? I know they hang out in Royal City Mall. Now there's no chairs to stop and rest for a few minutes so that they can keep going. So. You know, I know maybe Councillor Doss, you can maybe comment about what you're seeing locally.
Yes, I know the Royal City Mall very well. It's in my hood. Yeah, I do feel for them because it is essential. I know as a senior myself, I sometimes worry about, and the weather hasn't really cooperated except for the last few days. You need to get out. You need to see the faces. You need to be able to just, even with the mask on, be able to say. And I know this is where this addressing social isolation means a lot because they're really feeling cut off from the world. Their families are not young, the children are not around. I'm lucky to have my grandkids, but it is hard, and I don't know what to suggest except we'll continue with our Friendly Callers program. We will continue with our online coffee mornings. It's no substitute for face-to-face conversations, but I think it's the best we can do at this time. I really feel for seniors because I'm in that group.
Yeah, well, you know, I know it's been really a difficult year for many community members, and you know, I think many in New Westminster know that I'm a big walker, and you know, to me, it's been a challenging year. But I think to maintain both physical health and even more importantly, this past year, mental health, just making sure getting outside, getting some fresh air, and getting staying active is so important during this time, even though it's become that much more difficult.
I think also for seniors, with some of them with mobility challenges, including I have my hip problem as well. It's not as easy to just step outside and go for a walk. So I do appreciate the challenges that they're facing is much greater than people like you who can. So I totally understand where this question is coming from. I wish we had more solutions.
For sure. So we'll go to the next question. Does the vaccine clinic at the Anvil Centre follow safe guidelines of not booking too many people one day? Concerns are crowds and lengthy waiting before receiving the vaccine.
Yes, I can take that one. So yes, in terms of making appointments available each day, we are looking at how to make sure that the queuing doesn't exceed beyond a particular limit. So we do take proper analysis and precaution to make sure that all our clinics across the Fraser Health region, they have only a limited amount of queuing that is allowed. So as part of that, we do encourage to show up only between 20 to 30 minutes before the appointment, because that also allows us to make sure that some of the the volume of residents who are there trying to get vaccinated, that doesn't increase the overall volumes within the actual site. So in terms of the planning and making the appointments available, this is part of our consideration when we make for each day.
No, I think that's really important information, and you know, I only had a chance to briefly see the Anvil Centre in action today, but it did look very well organized, and people were very separated, and everything's very divided. And at least when I was here, it certainly wasn't overcrowded. So we'll now go to the next question.
Yeah, and this is probably for Dr. Tyler. I'm healthy and I've been careful and I've not had any issues. Why should I get the vaccine?
Yeah, that's a great question, actually. So the vaccine, as I'm sure you all know, but just as a reminder, boosts your immune system and develops antibodies against the virus. So should you actually be exposed to the virus, your immune system has seen it before and can immediately develop an antibody response, effectively killing the virus before it gets a chance to actually make you sick. The reason that's really important, even if you don't expect to get seriously sick, is because, well, first of all, you never know. I mean, certainly we know there are some higher risk groups who are more likely to be hospitalized or even die from COVID. But there certainly have been situations, it's not unheard of, where otherwise healthy people have gotten very ill and had some poor outcomes. And we are still studying the long-term impacts of COVID. We don't necessarily know, although some case studies are emerging, that some people can have longer-term sequelae even after a serious illness or hospitalization. So in my opinion, the safer bet is to get vaccinated, because you do never know, and it's an added layer of protection. But if that hasn't convinced you, then I would say the next reason to get vaccinated, even though you expect you may only have a very mild disease, is because if the virus is less likely to build up in your system, if it's less likely to sort of, if the antibodies are always fighting it in your system, you're not going to be as infectious to others. You're not going to have as much material in your coughs or sneezes or your spit or whatever, all these things, your droplets that you're making. So you may be less infectious to others, and you may actually be preventing further transmission within our communities, and you may be protecting your friends, family, elderly relatives, and others. Also, we need our case numbers to go down, and we need to get as many people some of this antibody protection to get herd immunity before we're going to be able to start to open ourselves up as British Columbians to some version of normal, something more like we experienced in 2019. And so the higher the vaccination rates, the lower the case numbers, the closer we're going to be to lifting some of those orders, getting the kids back in sports, being able to just normally interact with our friends and families and loved ones. And I mean, for that reason alone, I would really encourage everybody who's eligible to get vaccinated as soon as they can.
Well, thank you for that. So we do have another question that's come in. I'm a caregiver for my older spouse who has booked an appointment. Is it possible I can get my vaccination at the same time?
I can take that. Currently, if the caregiver is eligible as part of the age cohort, definitely they can. But at this point, from an age cohort perspective, people who are 70 and over, they are getting vaccinated. And then there are other priority groups, like in terms of healthcare workers, frontline workers, who would be prioritized. For caregivers, yeah, like if they are right now, like for this day, if they are below 70, like 70 plus, and then definitely they have an option to get vaccinated at the same time. If they are between 55 and 65, they do have the option of getting vaccinated from the pharmacies as well.
Okay, thank you. So we still have time for a few more questions. So if people do have some questions, please put those through. And okay.
So we jumped from 70 to 65 since yesterday to today. Can we expect those same jumps of ages on a regular basis in the coming days? I think it probably meant 65 to 70 since yesterday to today.
Yes, so I can probably take this one. So just wanted to kind of clarify that the 65 is open for registration. From a vaccination perspective, we are vaccinating 70. So people who are 65, they can go and vaccinate. And we are, like as and when the province would be releasing more age groups, we would be ramping up the corresponding immunization. So from a registration perspective, it's 65 and over. From a vaccination perspective, it's 70 and over.
Okay, and how quickly do we expect those age increments to I guess move forward, really getting to the root of the question for those that aren't quite there, but hoping obviously very soon to get there? For
sure, I think it's a combination of I think two things there for sure. Like one is definitely making sure that we have the corresponding supply to maintain that flow. At the same time, like over the last couple of weeks, as you would have seen, we started off 80 plus on March 15th, and it's almost 3 weeks, and we have gone through all the way from 80 plus to 70 plus. So we are working with province, and we are expecting some more clarification and direction in the next few weeks to make sure that we can open further. And Dr. Tyler, if you want to add on from your perspective.
I just need to answer as an epidemiologist that the underlying population denominator, the number of people in that age group, make a significant difference. Every age group will have a different number of people in it, and will therefore take more or less time to get through. And so this is now a provincial system, as you've heard, and they will regularly monitor the numbers that are coming through and ensure that no appointments are wasted and no vaccine is wasted. But it's really difficult to predict a very specific answer, because it will go either faster or slower depending on the size of the underlying age group, or what we call the population pyramid that defines that.
Okay, so I think we just have a few more questions to go. I did see one. If I get a Moderna vaccine as my first dose, will I get the same for the second dose?
Yes. It is actually quite important to remember what you had for your first dose so that you get the same second dose. Currently, the vaccines have not been approved as interchangeable. Studies are ongoing to that end, because it would be very convenient if they were interchangeable. But at this time, I understand that when the time comes to book your second dose, you're actually asked, what did you get to start with? And then the appropriate arrangements are made.
Okay, so very important to remember the one you received.
So do we have time for any other questions?
Yep.
Yeah? Okay. How or why does BC have such an outbreak of the Brazil variant of COVID-19? Did it travel from Brazil? Did the COVID mutate naturally here in BC into the Brazil variant? So it's a bit about traveling and whether it actually happened here.
Yeah, that's a really good question. I'm going to have to answer it somewhat theoretically, because I'm not sure that we know absolutely definitively which one would have happened. So all viruses mutate. We know this. This is not shocking. One of the reasons we need a flu vaccine every single year is not because the vaccine, not because you don't have antibodies anymore after you get the vaccine, but because the flu virus mutates and the strains are different every year. And to get the most up-to-date protection, we vaccinate every year. So this may or may not be the case for COVID. We don't have that information yet, but we know that there are variants, and we know that the virus is mutating. We've defined 3 of these variants that are specifically of interest for various reasons, but there will be other mutations or changes that are found in this virus, because that's a normal part of virology. That's simply how viruses behave and adapt to the environment. I strongly suspect that the variant probably traveled, because it seems less likely that exact same mutations would have happened in 2 different, effectively two totally unconnected populations. But it's not impossible for that to happen. It's just more unlikely. If you listen to Dr. Henry's announcement today, she did provide a lot of information about the statistics and epidemiology of the variants in BC, and actually mentioned that we're likely to expect that most of the COVID strains that we are now seeing are probably going to be different genetically than the original strain that we saw last March. And again, I can't stress enough that this is not anything that we need to get overly stressed about. I mean, we are looking to understand these variants. Obviously, some are much more concerning than others, but viruses do change, that we adapt to them. We have been doing this for quite some time now. And the fundamental precautions that we use don't change. The way in which this virus is spread has not changed. We still need to keep our distance, wear our masks, not, as Bonnie would say early in the pandemic, keep our hands to ourselves, stay in our own space, and prevent that transmission of the respiratory disease the same way we prevent transmission of flu and colds and everything else by not coughing and sneezing too close to each other, basically washing our hands and staying home if you're sick. That can't be overemphasized. I mean, I know it is difficult and has significant impacts on our lives and what we can do and who we can see, but it does really remain a very important preventative measure to avoid catching or spreading COVID.
Okay, well, thank you very much. So we are nearing the end of our time, but we do have time for one last question from Sandra. As I joined slightly late, I just wanted to clarify, what are the days and hours of the Anvil Clinic? I think this would be the hours of the Anvil Center Vaccination Clinic.
I can take that one. So, this opened, Anvil Center opened on yesterday. But starting next week, it would be a 7-day clinic, and it would be operating for 8 hours every day.
Okay, wonderful. Okay, well, that does conclude our time here this evening, but I do want to thank everyone for joining us for this really important community conversation. I want to give a big thank you to our partners at Fraser Health who took the time this evening, Dr. Tyler and Mr. Sanja, for really helping engage and help inform and get really good information out to the community. So thank you both so much for joining us. I also want to thank my colleague, Councillor Chinu Das, for also participating and joining in this conversation. We know, no doubt, this has been a challenging and difficult year for the community, but you know, I think one of the heartfelt things that I've felt is, and what I've been inspired about is just how compassionate and forgiving our community has been. And I think Dr. Bonnie Henry has provided some tremendous leadership, and I think her words of being calm, being kind, I think really resonate and have been so important to help us get through it. So as we move forward, I want to encourage folks to stay up to date with the latest information, because new information is coming out daily, and to visit fraserhealth.ca to get the latest information that's coming out. Also, with respect to city programs and the work we're doing at the City of New Westminster related to COVID, please check the city's website as well to make sure that you're fully informed about all the changes that have been occurring and how to make sure to keep yourself and your community safe. So with that, I do want to say good night and thanks everyone for joining us this evening.
Thank you.